back. Well, the HSRC has started an HIV Prevalence Survey. It's a survey designed to show how many South Africans are HIV positive, but also how many are taking their ARVs and are able to get treatment. Steve Letsike is the co-chair of the SA National AIDS Council. Ma'am, good afternoon to you. How important is this survey?
Look, the importance of the survey really teaches us and helps us understand, the critical element of diagnostics, those on treatment, and indicate the cause really of the HIV epidemic. And it is our important agenda to understand the data that is available, the number of people that needs to be sampled around the prevalence, HIV prevalence, the rates of number of risk, behavior risk factors in terms of the transmission. So it really tells us what we need to be understanding of the epidemic and what we need to be doing in response to the epidemic itself.
I mean, a large part of it is about the kind of treatment. Are people who needing treatment actually get it? Do you think a survey like this is going to help us find where people have problems and where systems are working?
Of course. I mean, a true reflection of the prevalence on this helps us understand even the geographical location and demographics we're dealing with. The importance of this is the challenges we already know. Various programs, various activities, NGOs have already diagnosed some of the challenges in terms of access to treatment, but also access to some of the other services, SRHR services. So it is quite important to really know how best we address these challenges, and as well as a sector or SANEC Council itself, how do we even highlight some of the social and economic conditions of those who are taking treatment or those living with HIV.
Do you find most people are actually comfortable in answering questions about their HIV status? I mean, the way that we view HIV as a society, I think, has changed dramatically over 20 years. Much of the stigma has gone. I think there are pockets of it still. Do you think people are happy to actually engage with someone doing a survey like this?
Well, I think it's always a catch-22 situation in our country where social behavior has always remained one of the biggest challenges. I think there's comfort in knowing that HIV is looked at as a chronic condition. We have normalized understanding, knowledge, and even education around HIV. But the self-stigma and those who suffer from it often are the ones that then becomes uncomfortable in answering those questions. But I think in understanding that this is a health benefit of understanding, a health benefit of the society, it really would help in participating in such survey. So the behavioral risk must be owned and must also be shared in terms of responsibility. So you may actually be surprised that people are comfortable as well in other spaces.
I mean, the way that we talk about HIV, and over the last 2 years we've been talking about COVID-19 so much, we haven't spoken much about HIV at all. Do we need to start just refocusing our attention a little bit? I mean, HIV is the pandemic which is having such a big impact on our society still, even with antiretroviral treatments.
Well, look, I think this is one pandemic we've been dealing with. We have multiple pandemics as a country that we often deal with, such as HIV, TB, as well as non-communicable diseases, and even COVID, adding to a number of other pandemics, including gender-based violence. All these are pandemics, and these are social challenges that requires health interventions. So I think if we have a better health-seeking behavior, we really would understand the need to empower ourselves, educate ourselves even more. But I think what is much more needed in the disruption that we have seen of COVID, because COVID did disrupt HIV response. It disrupted quite a lot of health services in all the health facilities or sites for that matter. So we need to remind South Africa that we have not closed that business of HIV. We still want to see prevention efforts where we saw quite a lot of unprotected sex or quite a lot of risky behavior taking place. But we also want to see those who are living with HIV having access to the treatment. We have over 4 million people on treatment. We have over 8 million people who are living with HIV. And the president was clearly stipulating that we needed to put 2 more million people on treatment. Why? Because prevention works, viral load can be suppressed, and you can be undetectable if you adhere to your treatment.
We know, for example, that we are still the country, as far as I know, that has the highest number of people living with HIV. It defines our society. Do you think that this prevalence survey may come with results that surprise us, in that we may find that the figure is much higher or maybe a little bit lower than what we currently think? It's been quite a few years, I think, since we last did a survey like this.
Well, I think one of the key things I can tell you, it's not the only survey that exists. There has been quite a number of data collected over the years that actually have shown us that we are actually winning. We are coming closer to winning this battle, but we need to do it in a very fast manner where we are not walking in a snail pace. We've seen the reduction of new infections amongst adolescent girls and young women. If you were asking us about 5 years ago, 2,500 new infections on a weekly basis amongst adolescent girls between the age of 15 to 17. But right now we are even below 1,000 of those new infections on a weekly basis, which then means it's telling us that we are really reducing the rate of new infection. But similarly, if you were even talking about the number of people we had on the roll on accessing ARV, but now you can actually even see we've put over 1 million people on treatment. What we need is adherence. What we need is close the tap of new infections. But also what we need is to address the social and structural drivers, address the needs of sex workers, address the needs of transgender, address the needs of people who inject drugs, because those are some of the key and vulnerable population where we understand the epidemic and the levels of interventions that are needed in marginalized communities.
Steve Letsike, thank you very much indeed. Co-chair at the South African National AIDS Council. I really do appreciate the time.